Today we will be discussing, just watch.
In this video, I will talk about infertility. I will start with the definition, we'll talk about types, assessment, and treatments. If you want to support this channel and see more videos like this, please like and subscribe. Don't forget to hit the bell button to be notified when a similar video is posted. Let's get back to it. Infertility is defined as the inability to conceive after 12 months of regular intercourse. It can be divided into primary, in which the couple have never had children, or secondary, which is when the couple have had children before but failing to conceive again. It is always a good idea to take thorough history from both partners. Therefore, it's recommended that the male partner attends the infertility clinic as well. Investigations can be divided into male parts, which include semen analysis, during which the volume, concentration, motility, morphology, in addition to other factors, are assessed. And the female part, which starts with ovulation investigation, especially if the woman is not having regular periods. Those include PCOS investigations, thyroid testing, prolactin level, and FSH level. Testing for uterine cavity and tubal patency can be achieved using hysterosalpingogram by injecting a contrast inside the uterine cavity and obtaining an X-ray which will show the shape of the uterus and spillage from both tubes. Or it can be achieved by performing a laparoscopy and chromotubation. This is done by ejecting a dye in the uterus and visualization of the dye spillage from the tubes. At the same time, a hysteroscopy can be performed to assess the uterine cavity. Ultrasound is not a good modality to assess the tubal patency and the uterine cavity. If ovulation is not happening naturally, medications are available. Those include clomiphene citrate, letrozole, and gonadotropins. Clomiphene citrate works by blocking estrogen receptors in the hypothalamus. Therefore, the hypothalamus increases the release of gonadotropin-releasing hormones, leading to increased level of FSH and LH, which in turn induces ovulation. Letrozole blocks the conversion of testosterone to estrogen by blocking the enzymes that achieves that, which is called aromatase. Therefore, the level of estrogen will decrease, leading to increased production of gonadotropin-releasing hormones by the hypothalamus, and the FSH and LH by the pituitary, which induces ovulation. If medications fail, intrauterine insemination can be attempted, by which the sperms are injected directly into the uterine cavity around the time of ovulation. Another method is in vitro fertilization, which involves performing fertilization outside the body and then transferring the fertilized ovum inside the uterus.
Don't forget to check out my books on Amazon. One of them is called OBGYN Made Easy. Don't waste time on the shell, the pearl is inside, and the other one is for questions and answers. And the links are provided below. If you want to support this channel, please like and subscribe. If you have any question or any suggestions, please leave them in the comments below and I will do my best to address them. Guys, my commitment to you is to provide you with the latest information based on the most recent American College of Obstetrics and Gynecology guidelines. Thank you and see you next time.